Sarah, can you see my screen?
Yes, you look great. Looks great.
Okay, fantastic. So I just wanted, again, to welcome everyone and let you know that the 2 PowerPoints we're going to be looking at today with our content experts are available on ACCE's Chamberpedia page. This is under the Education Attainment Division. So just a reminder, if you go to Networks in the top center and go to Education Attainment Division Chamberpedia pages, you will see this Workforce Wellness and Community Health as one of the options. This has a lot of great resources you are welcome to utilize and share with your colleagues. A number of communication briefs that are very business friendly, some examples of other chambers working in the health and wellness arena. And at the bottom, a lot of information about the Affordable Care Act, including a recording from this webinar, which we did on Monday, and today will be a repeat of that same webinar. You can see right under presentations, health coverage for small business employers. If you click on this link, you'll get a recording of Monday's webinar. And then you will see below the shop marketplace and small business majority owner presentation. So what we're going to walk through in the next 28 minutes is also available on this website. So right now, I would love to hand it over to David Adler from the Robert Wood Johnson Foundation to welcome you all.
Hi, this is David Adler. I'm a program officer at the Robert Wood Johnson Foundation, and we are a national foundation committed to building a culture of health in the United States, and having affordable, stable health insurance is one important component of that. And we are very excited to be working with the Association of Chamber of Commerce Executives to be able to reach local chambers, many of whom may have members whose employees are eligible for coverage under the Affordable Care Act. And with open enrollment starting on November 1st, we're very eager to make sure that everyone has information that will be useful for individuals and businesses that are looking to sign up for coverage. So we're just very pleased to be able to do this and to be working with a new partner. So with that, I will turn the webinar back over to the content experts.
Fantastic. Thank you, David, so much. And again, we are going to open this up. We're going to hear from David Chase for about 5 minutes, and then we're going to hear from Dean Mose for about 5 minutes, and then we want to make sure we spend the last 10 to 15 minutes of this webinar on a Q&A session so that we can help you with any specific technical assistance questions you may have. Again, ACA is settled policy, and so we just want to make sure we are offering you the resources, the content expertise, and the support you need to help your small business members. So with that, I am going to turn it over to David Chase, and you will see his presentation appear shortly on your screen.
Great, thank you so much. Happy to be here. I just wanted to start off letting everybody on the call know a little bit about Small Business Majority, just so you kind of know where we're coming from. We are a national small business advocacy organization with offices across the country, and we focus on helping to engage and inform small business owners about different policy issues that directly have an impact to their small business. So healthcare is certainly probably our top issue, but we've engaged in a variety of issues. And to conduct this work, we primarily work through partner business organizations like chambers of commerce. So we're not selling anything or looking to build our own membership. We have some resources, and we're really looking to share those with other business groups to help you all educate your members about a variety of different issues. You know, in the next slide, we can talk a little bit about some of the sort of the different pieces that our different curriculum covers, and I'll talk a little bit about how we were able to disseminate the information. Just kind of want to let you know first what the information is, and when we talk about providing resources on the Affordable Care Act, what that really means. So Number one of the major changes in the ACA is there are a number of changes in terms of the way that insurance is regulated. That means that there's additional benefits that plans are required to include. That means the way that employer and employee premiums are calculated are different. And so we go over all those sort of details so business owners understand, hey, what am I getting for my money, and why are the premiums calculated a different way? Maybe my costs are going up, maybe they're going down. It's sort of giving some context. There's also provisions in the law that help to bring down costs. Obviously, we know that cost is the single biggest issue facing employers when it comes to healthcare, and so we want to educate folks about the provisions in the law that are aiming to cut some costs out of the system. I'm guessing that most of your members are sort of on the smaller side, meaning under 50 employees, which means that they're not directly impacted by the employer responsibility provision in the ACA, so they're not obligated to offer coverage, not penalized for not offering coverage, but we sort of cover 50 is that threshold, 50 employees. So how do you calculate employees? What happens with seasonal and part-time folks? And for those larger businesses, how does all that work and all those different calculations? A big piece is focusing on getting folks enrolled. We know some small businesses are able to offer coverage, so we want to talk about options for group coverage. But we know many of your members are probably self-employed, don't have employees, so the individual marketplace is an important thing to let them know about, as well as businesses that don't have employees, or businesses that have employees but are not able to offer coverage. We know those employees at the end of the day still need to have access to coverage. There's a requirement for them to have coverage. They want to have coverage, and many times they go to their employers with questions about, well, how do I get enrolled, and where do I go, and how does this work? And so we want to be able to arm employers with the information, so when they get those questions, they can guide employees to the right direction, even if they're not able to offer coverage directly themselves. So if we go to the next slide, I've got just a list of different sort of things that we can do to help get information to your members. We have a national webinar on the ACA that we do every 2 weeks. It's available across the country, and that's in English, and then we have a monthly version that is available in Spanish. We do, for the states that we have offices in, we have an on-the-ground presence in about 10 states, and we do in-person workshops and speak at conferences, things like that, so we can come in and present directly to you and your members, and kind of give all the facts and all the information and resources. We have a monthly newsletter. We'd be glad to get you involved in that. We have an annual meeting with business leaders and business owners in Washington, D.C. To give them information and allow them an opportunity to talk to elected officials and other policymakers. And our website which is smallbusinessmajority.org, has a very detailed FAQ and some fact sheets about the law. There's a small business tax credit calculator. There's a small business tax credit that's part of the ACA. This is a pretty quick way to find out if a business is eligible. We also have a health coverage guide available in English and in Spanish, which sort of walks employers through the process of offering coverage in a very easy to follow step-by-step process. And there's a glossary of different terms, so if you're unfamiliar with the process of buying coverage, all those sorts of things are explained. And it's, like I said, very step-by-step and easy to follow. And this, I think the last slide is just contact information. Instead of giving you all the links and the URLs and everything, feel free to give me a call or email, and I'd be happy to send you the links to the health coverage guides and the FAQs and all those sorts of things. And if you're in a state where we have a physical presence, we'd be happy to connect you with our folks on the ground to see what we can do to help provide some resources to you and your members. So with that, I will wrap up.
David, thank you so much. I just want to let all of our participants know that we will be following up with you individually following the webinar. If you have any direct questions, both of our speakers have agreed to connect with you one-on-one. So please do feel free to reach out to David for his contact information listed here. And we will also follow up with you to see if you would like us to make that warm connection to help with any specific questions you have within your community. So with that, I am going to turn it over to Dean, who's going to talk to you a little bit about SHOP. Dean?
Great. Thank you. It's a pleasure to be with all of you today. I feel this is a bit of a homecoming. I used to work at a Chamber of Commerce in New York for the Brooklyn Chamber of Commerce. I was there for 5 years running their health insurance program and interacted with thousands of small businesses and probably even more insurance agents. So it's a real pleasure to be with you all today. I'm not gonna talk about everything on the slide deck today. My understanding is you're gonna have copies of this, so I won't touch on everything. But I wanted to provide you with a bit of an overview of what the SHOP marketplace is. First of all, can advance to the next slide. SHOP stands for the Small Business Health Options Program. It's part of the health insurance marketplace created by the Affordable Care Act. It offers small employers, and when we say small, we're generally talking about those with 1 to 50, a choice of quality health and dental plans provided by private health insurance companies. In some states, you may be aware the definition of small group actually has been extended to 100, but in most states it is kept at 50. So depending on if it's 1 or 50 or 1 to 100, the SHOP marketplace would comply with that definition. On the next slide, I'll touch on some of the benefits of the SHOP marketplace. The SHOP provides convenience and choice in that a group is able to complete their new group enrollment at any point during the year. We're about to enter open enrollment for the individual marketplace. SHOP doesn't have a defined open enrollment period. We're open 12 months out of the year. It allows you to browse, compare, and apply for health and dental plans all on healthcare.gov. It offers one or multiple plans, and you're able to receive one bill and make one premium payment a month. Another feature of the SHOP that's different, I think, from the outside market is that it really does provide some tools to control some of the employer spending. Employers decide which plans to offer to qualified employees and how much they want to contribute to their health and dental insurance premiums, whether they want to offer dependent coverage or not. And then employees can go shopping and they can pick the plan that works for their family members. And the business owner, though, is paying a defined amount, and the employees, depending on what they choose, would pay either more or maybe even get a credit if they chose a cheaper plan. A significant feature of the SHOP is it allows employers to have access to the small business healthcare tax credit, which is an exclusive tax credit for employers who purchase coverage through the SHOP. It can provide up to 50% tax credit for employer contributions to premiums. And SHOP is also open to nonprofits and tax-exempt organizations, which I guess would apply to many chambers of commerce. And you can get 35% of your contributions to premiums back in a tax credit. Importantly, there are many ways to get help in SHOP. As I mentioned, we have many resources available on healthcare.gov. We also have a dedicated SHOP call center for both employers and employees, as well as agents and brokers. Significantly, SHOP Marketplace is agent broker friendly, and we welcome participation by agents and brokers. On the next slide, I just want to touch on some of the eligibility criteria for SHOP. As I mentioned, it's generally available for employers with 1 to 50 employees. Employers do need to offer coverage to all full-time employees to enroll in SHOP. Just like the outside market, you have to have at least 1 employee enrolling in coverage, and you have to obviously have a principal business address in the SHOP in the state in which coverage is being offered. So on the next slide, it just touches on which states can enroll in the SHOP marketplace coverage through healthcare.gov. I'm not going to identify all of these. I'm sure you can see your state or not. If your state isn't located, the next couple of slides give the addresses for the state-based shops. So you'd go to the individual state marketplaces to sign up for small group coverage in the SHOP through one of these states. Let me just wrap up by telling you on the next slide what's new in the SHOP marketplace for 2016. Well, I wanted to let you know that we were transitioning employee choice across the country, and next year employee choice will be available in all states and the District of Columbia. And so again, that means employers will be able to offer either a single plan, but choice allows them to offer multiple plans from multiple insurance companies. And that's kind of one of the unique features of SHOP, because that is not generally available in the external market. In the SHOP marketplace that utilizes healthcare.gov, we are offering dental-only options this year. And what that means is that employees who are offered both health and dental can choose to enroll in both health and dental, health only or dental only. So perhaps somebody has health through a spouse and they want to just sign up for one or the other. They can do that now with the SHOP marketplace this year. Significantly, we are relaxing our minimum participation rate methodology. So as you know, in most states, there's a participation requirement. You have to get generally 70% of employees to sign up for coverage. We're making it easier this year for employers to meet that 70% threshold by giving employers credit for employees who have other coverage, perhaps through a spouse or through a public program such as Medicare. So we think that's going to make it a lot easier for small businesses, again, to sign up and enroll in SHOP this year. And so we think that's yet another reason why small employers may want to check out the SHOP for this year. Many resources are available on healthcare.gov, as I mentioned. The most significant one is probably our it's called our window shopping feature, where you can go in without creating an account. If you can go to the next slide, please. It basically allows you to go online, enter some information about your employees and dependents, and you'll be able to get a rate quote without actually signing up or giving any identifying information. There's a number of other resources also that are on healthcare.gov. I won't go over all those, but these will be included in the slides that will be available to you after the call. You know, one of the things in conclusion that was very successful when I was at the Brooklyn Chamber of Commerce was to hold informational sessions. It really wasn't a value add to members. People came together, they learned about the Affordable Care Act, what it meant to their business, what some of the requirements were, what's changing, what's not changing. And we always had agents and brokers on site to you know, actually help people enroll in coverage, whether it be through the SHOP marketplace or the individual marketplace. So if you haven't already considered doing that, it's one of the things that really drew a lot of participation for the membership while I was at the Brooklyn Chamber. So it's something you might want to consider if you haven't already done that already. So with that, I'm going to just you know, be open to any of your questions, and if you have any follow-up questions after the call, I'm happy to answer those as well.
Fantastic, Dean. Thank you so much. I want to pause on a couple of these SHOP marketplace resources, and I want to unmute our participants to open this up to Q&A, and please don't be shy. Please feel free to ask any question that you think may help to benefit your small business members. I do see that we had a question submitted from Nicole Christian, and she asked if the tax credit, Nicole, correct me if I'm wrong, I just unmuted you. Can you hear me, Nicole?
Yep.
Fantastic.
I'm here.
Would you like to ask your question about tax credit?
Sure. I'm just curious if you only get the tax credit if you actually go through the SHOP program. We provide health insurance for our employees here at the Chamber. In the past few years, we've received a tax credit, but I'm pretty sure it wasn't 35%, and our accountant had said that was going away. So I don't think our insurance agent has gone through the SHOP program, and especially Maryland had such problems with their small business, small employer healthcare program. Initially, it was a real disaster, so it wasn't even available for like the first year. But so I'm just wondering if now, since we just go through the external using our broker, will we no longer get the tax credit?
Yeah. So you're from. This is Dean. Are you from Maryland? You said.
I am.
Okay. So let me just clarify. I mean, maybe I should have said generally available for the shop marketplace. There's a few instances where there are state-based shops that are still kind of standing up their online marketplace, and Maryland is one example of that. Until the Maryland system is fully up and running, we were allowing small employers to enroll directly with an insurance company and perhaps using an agent or a broker. And for those kind of select states, they were able to access the tax credit. We had worked something out with Treasury and IRS. So that could have been one of those examples. Now, to your point about the tax credit going away, that's a really good point. The tax credit is not going away per se. For your particular situation, it might be going away because the tax credit is only available for 2 consecutive years starting in 2014. So if you've claimed it in 2014 and 2015, your accountant is right. It wouldn't be available for you in 2016. But anybody who signs up, even for the first time in 2016, the credit is available for 2016 and 2017. And it will continue unless Congress changes the law. So I hope that clarifies things.
That does. Thank you very much.
Sure, you're welcome.
Thank you so much, Nicole. I want to open it up to any of our other colleagues who are on the line. I see that Jill, I believe, unfortunately, that I cannot unmute you. I've sent you your PIN if you would like to be unmuted, but you can also feel free to type a question in the chat box. I would be happy to read that aloud for you. I see that we also have the Turner County Chamber represented on the call. Ashley Miller, can you hear me?
Yes, ma'am.
Ashley, was that you?
Yeah, can you hear me?
Oh, yes, now I can hear you. Thank you. I just wanted to check in with you and see if your team had any questions or any kind of technical assistance we can help you with.
Oh, no, ma'am, I'm good.
Okay, fantastic. I do want to acknowledge, I know that Aaron Nelson, from the CEO from the Chapel Hill Chamber, is on with us. And I was just hoping we could review. He had asked a great question on Monday's call, just kind of asking to circle back to the discussion on tax credits, both for profits and nonprofits. And so I know we just touched on those with Nicole, but Dean or David, since we have a couple of minutes, was there anything else you wanted to add about the tax credits available? I know that might be very attractive to some of the small employers who are members of the chambers on the phone.
Maybe, David, do you want to touch on the refundable component of the tax-exempt piece? Is that something that I think was mentioned the other day?
Yeah, sure. And this is probably relevant to a lot of you that run chambers as you're a nonprofit employer yourself. So for a for-profit firm, the tax credit is non-refundable, meaning if you don't have a tax liability, then you're not able to claim the credit in that year. But it does work differently for nonprofits. So it's refundable for a nonprofit employer that qualifies for the tax credit, and you can deduct that goes against your payroll taxes. So definitely look at it. It's not for everybody. Everyone's not eligible, but like I said, we do have a calculator on our website that will quickly kind of give you an idea if you're eligible or not. And so obviously, if you're eligible for up to 50%, that can be substantial savings for those firms that are eligible.
Fantastic. Thank you, David. Any other questions on the line? I see we have a couple of other chambers represented. Okay, hearing none, just want to let everyone know that, again, we will send you individual follow-up emails, just making sure that you are able to get your questions answered. And if you would like to connect one-on-one with David and or Dean, our two content experts from today, we will make sure that we do a warm email introduction. And again, if you visit ACCE's website, the Workforce Wellness and Health Chamberpedia page, has a recording from Monday's webinar and also the 2 PowerPoints that were presented today. So please feel free to share those very freely. My email address is abell, A as in Apple, B-E-L-L, @acce.org. So please feel free to email me as well should you have any questions or if we can provide any additional assistance to your chambers. Thank you all so much for joining us.